Okay, well, let's go ahead and get started. I want to welcome everyone today. I'm going to spend a few minutes here and then I'll jump on and help out the English channel. We are grateful for everyone could take the time to do this. We are grateful for the presenters. We'll follow the agenda. I'll let Sarah kind of dictate the time. One thing, if we could just remind everyone to keep everything on mute unless you want to talk. If you have a question, just maybe chat with Sarah and she'll make sure your question's answered, and we'll actually have a few minutes after each presenter. So you can either save your questions till the end or right after the presenter. So anyway, welcome, and let's have a great meeting. Thank you.
Okay, I went ahead and muted everyone because we had some new participants who were not muted yet. So I think everyone should be muted now. So if you're a presenter, you may have to unmute yourself again when it's your time. So we're going to just start and get right into our health insurance. Celia Nash with Team Nash has some of her team with her. And so I'm just going to send it over to Celia.
Thanks, Sarah.
Can I say one
welcome,
thing?
everybody.
Can I interrupt you really quick before we start?
Yeah.
I don't know if Robert said, but anyway, did he talk about the chat box?
He has not spoken about the chat box.
So if any of you guys have questions during this presentation, at the bottom of your screen, there's a place where you can type a chat. If you have some questions, type them in the chat, and we'll make sure that Celia and her team can answer them. Also, at the end of her presentation, we'll unmute everybody, and if you want to ask a verbal question, as long as you're polite and don't interrupt each other.
Okay. All right. Well, welcome, everybody. Thank you for making this happen, RMD. I know under these circumstances, and it's always hard to do things like this through a virtual meeting, but I believe we can make the best of it. So I am going to have Jenny Thompson with Select Health speak first. I feel like the health benefits are such a big deal. I want to make sure everybody's aware of all the benefits. She's briefly going to talk about your benefits because they are the same this year as last year. But there are some services that she wants to make sure you are aware of. And then I will, after that, with the remaining minutes, just quickly go through the rest of the benefits. So Jenny, if you want to take it over now, it'd be great.
Can you hear me?
We can hear you.
Okay, here I go. I'm going to share my screen here. Okay, can you see my screen there?
Yeah, you might want to do it from beginning, from the beginning. Try it again.
Let me just switch over here, I think. Is that better?
Not yet.
Really? What am I doing here?
I've got the screen.
Let me try to share it again, see what happens. Sorry about that. I don't know. We practiced.
Yes,
and it worked fine. And now it's not. Okay, let me try one more time. Are you still seeing all the side, or are you seeing one big screen?
Nope, we can still see the side.
I don't know why it's doing this. Still the same
Now I'm not seeing any of your screen.
Hey, Jenny, what we can do is I can do my portion real quick while you're trying to figure that out, and we'll come back to
Okay.
you. And it might be that you have to, I could see at the top it was grayed out where it said to start video. In fact, so maybe there's something going on with your screen, but then we'll come right back to you.
Okay.
Okay, so let me just share my screen. Mine's going to take maybe 5-10 minutes, and then I'll come back and have you do the benefits discussion. So let's do this.
Okay.
Hopefully mine's not going to play the same game. Okay.
Yours looks great, Sarah.
All right. Welcome now again. I'm just going to, briefly go over the benefits, and I will skip the part about the health insurance so you guys can hear that directly from Jenny. But, I wanted to put this slide in here because I remember meeting Robert and Sarah years ago, and their big thing was they wanted to make their plan healthy, and they wanted to make their plan affordable. And I don't know if you all remember what health rates looked like for RMD years ago, but they were so high, and RMD was willing to do whatever they could to try to get those premiums more in line, and they did so by really investing a lot of money in the cost of employees' health insurance premiums. And I'm saying they did a big amount. And that in turn has just given you guys some amazing renewals over the years. So I wanted to point this out because in 2019, RMD, by switching to Select Health, received a 4.3% rate reduction. It's not really heard of, but sometimes when you switch carriers, you do get a rate reduction. But in 2020, -5. You guys remember that last year? And then this year, -2. So you guys have run really well. You're doing a great job as a company. I mean, part of these increases are also due to how the utilization is, and employees have been doing really well. There are things that you can take advantage of that, Jenny can talk about too, but very impressive to see that. So you have the two health plans, and like I said, I'm not going to spend time on talking about those two because Jenny will briefly talk to you about the co-pays, but just want to remind people about Connect Care. And this is the portal for Connect Care, and this is the online, I'd say the teledoc that is available through Select Health. But it is such a great service, and it is so easy to use. And starting in 2021, it's actually going to be at a zero copay. So there wouldn't be any reason for anybody not to take advantage of this. You can call a provider, you download the application on your phone, you put in your policy number, and then you let them know you need to speak to somebody. You get a high quality provider, within minutes, 24 hours a day, and that provider can prescribe medication. They can, they can say, no, I think you really should go to the emergency room. No, go to the urgent care. But these are one of those tools that I would definitely use before you, go to the urgent care, go to the emergency room, because a lot of these things can be handled over the phone, and they can actually, like I said, they can fill prescriptions as well. So just want to point that out, and also point out it's going to be at a zero copay, even on the high deductible health plan. So that is also nice for those people on that plan. They're not even going to have to pay anything for the teledoc feature. The dental plan is staying through Dentist Direct. And just as a summary, you guys have, familiar with this, but there were two things that we were able to change this year. One being the fact that your annual maximum went up to $1,250 from $1,000. So RMD was able to negotiate that. Rates stayed the same. And the other thing is I don't know how many people were aware of this, but you used to have cleanings at one every 6 months. And sometimes that's not always convenient. If someone's going out of town, then they want to get in to see the dentist before they leave, and they might be in there before that 6 months clock ends. So they no longer have that limitation now. It's just 2 every 12 months, and they're not going to keep track of the 6 month limit. As a reminder, your cleanings are covered at 100%. Your cavities are covered at 80%. Major services, which are going to be like crowns and bridges, are covered at 50%. The deductible only applies for those things of cavities and crowns. Other than that, it's an amazing plan. You do have a discount on orthodontia. And the other nice thing is there's no waiting periods for dental work. So that's a really nice plan on the dental. And then for the vision, that remained the same as well. Just wanted to point out a couple of things, that you do have an eye exam covered under Select Health, so that's great. But if for whatever reason you don't want to use one of the providers through Select Health, you can go to a provider through this plan at a $10 copayment. You have $150 you can use towards your frames, or you can use them towards your contacts. So it's up to you whether or not you want to do frames or contacts, one or the other per year, so they won't let you do both. And then for lenses, you just pay a $25 copayment. I want to point out that if you do go out of network, you can do that. You can see a provider outside the network. For the contacts, it's not reduced too much. It's down to $112. For frames, it's definitely reduced. It's only a $75 allowance, so it is cut in half. So think about it before you go out of network, because it could make, you know, a difference of how much it's going to cost you for those frames. And then also the copays for the lenses are quite different. Instead of being a copay, they'll only pay up to 25, or they'll only pay up to 40. So I definitely, for your glasses and frames, use an in-network vision provider. And then on, the life insurance. This is another really nice benefit. It's through MetLife. This isn't changing, but just as a reminder, you can purchase up to 5 times your annual earnings, up to $500,000 for life insurance. The guaranteed issue is at $100,000, but keep in mind, if you didn't go on this plan when you're initially eligible, then that guaranteed issue doesn't apply. However, I would still encourage people to take a look at these numbers, because they're still very competitive with what you can see out in the market. And you have an opportunity to buy this insurance at a low cost. And if you do, if you are required to fill out the health statement, it's a simple form. You answer some medical questions, send it in, and they'll let you know if you are approved for that amount. You can buy the spouse up to $100,000 and your kids up to $10,000. And the portal, for those that have been through the portal before, it will automatically calculate those amounts. You use a slider rule that goes across, and you can see what the different amounts are. It will track what you had enrolled in last year, and you can decide if you want to change that for the next policy year. And then I'm not going to spend a lot of time on this FSA, because I know Ruta is going to be going through on the FSA. Just want to point out a couple of things. Keeping in mind is that it is pre-tax dollars, so any dollar amount you want to put in a flexible spending account is deducted from your paycheck before taxes are calculated. And the other thing is that if you have an HSA plan, a high deductible health plan, and you know RMD is contributing money towards that HSA, you cannot select a normal FSA. It will be called a limited benefit FSA. And so what you can do is you can say, okay, I don't want to use my HSA dollars for dental or vision. I would rather have another way of setting money aside into a plan that's pre-tax. You can use that limited benefits for dental vision expenses. Plan carefully, because it's use it or lose it. There is a rollover that I know Ruta will talk about. And the other thing I want to point out, it's not portable. If you change jobs, then you forfeit that money in the FSA. Whereas with the HSA, it's a little bit different. And with the HSA, it still saves you money because you can deduct it pre-tax, but it is portable. So the minute those dollars are put into your account from RMD, that money is yours. And if you change jobs, that money continues to go wherever you go. I know RMD is changing their philosophy this year on the contribution. They are still contributing money, and it's all listed on the portal. And what I do want to tell you that if you have any questions as you're going through open enrollment on how that works, feel free to reach out to our office, and we can assist you with those questions. This type of plan can also be really nice, like as far as an improved retirement account, because you can put you can max out your contribution on this, and keep in mind that when you hit age 65 with normal retirement plans, any dollars that you pull out of a retirement plan, you're taxed on because you were taxed on it when you put the money in. With a HSA, if you take the money out after age 65 and it is to use to spend for qualified medical expenses, that includes COBRA premiums, Medicare premiums, long-term care, you'll never pay taxes on it. So it's really smart to kind of think through this and say, well, do I want to utilize this also as a way for me to have money as I get older and know that I'm never going to have to pay taxes on it? And that, that's a pretty big deal on the health savings account. So just remember, on the open enrollment, we list the medical, dental, and the life insurance as passive, which means if you do nothing, your benefits will be rolled over as they are now, because those benefits are not changing, they're just enhancing. But in order to be in the FSA, or even the limited benefit FSA or the HSA, you have to re-enroll. And that's super important, because the way that RMD is strategizing their HSA contributions this year, you're going to want to go in there and do something so you can get the most benefit out of those dollars that RMD is spending. So the other thing that we always want people to do is be able to acknowledge the compliance notices every year, just to say that they're aware that there's compliance notices. So even though this is passive, I'd still encourage people to do it, because if you have a high deductible health plan, you'll lose out on any dollars for that HSA. So, go through there if you can. So are there any questions for me?
Celia, I had one question on hearing benefits. Would those be covered under FSA?
And HSA, both.
And HSA. So if someone has an HSA and they did a limited FSA, would those cover hearing?
No, limited FSA, I don't think. Ruta, can you unmute yourself and confirm if the limited benefit will cover any hearing aids, or is it just the dental and vision? Oh, she's not unmuted. It's pretty, it is, and by the way, Ruta, it's star six to unmute if you get it. But I'm pretty sure, Sarah, it's just the dental and the vision, okay, unless something has changed on that.
When she gets on, we can double check that with her.
Okay, sounds good. All right, let's see if Jenny was able to get hers fixed. I'm going to stop sharing my screen, Jenny, and see if you can get on. Are you there?
Yeah, let me try here and see if I got it figured out. Okay, can you see?
Okay, do what Jenny you can do, because I know you're good at this on figuring out, but can you change, you can maybe that where it says click to add notes or something, you can actually, I think, make it so it's smaller, and then you could just use the sidebar and just go through it that way, and then it is hiding your notes. But you're not gonna be able to see them, but I'm sure you've done enough times.
Yeah, I can't, so I'm not sure what screen you're seeing. So you're seeing the main screen, and then on the side has a side note.
Yeah, yeah, it has actually the slides, yes.
So do you have two screens? Maybe you're sharing with us the screen that you don't want to share.
Yep, I do have two screens, but I don't know why it's sharing that way. I'm so sorry.
Okay, let me do this, Jenny. If you give me a second, I'll pull up your slideshow, because you send it to me. Let me see if I can find it. You just tell me to switch to the next slide. Just a minute. Let me find it.
I've actually used it since then.
You pardon? Oh. But you want to just use it just so.
I go through with the slides or with the notes. It's totally fine. Okay. So sorry for the hiccup, everyone. Thanks for coming to this virtual open enrollment meeting. And I'll go through these slides real quick. Some things Celia has touched on, and so I'll try to be real quick through those, and other things are going to be new. So first thing with your plan through RMD management is you are offered the Select Health Med Network, which has 7,200 providers. You can live and work anywhere in Utah and access these benefits. It's 100% of Intermountain Healthcare, but you also have access to Huntsman Cancer Hospital, Primary Children's, and Moran Eye Center. A little bit Silly had talked on is their telehealth off benefits, and you do have those out-of-network benefits. So your benefits have not changed. Are my slides changing?
Yes.
Yes.
Okay. So you still have the two plans that are offered. You have the traditional $1,500 plan. That's a $1,500 individual deductible, the $3,000 family. On this plan, you're going to have your co-payments that are pre-deductible. So if you go to see a primary care doctor, you have a $25 co-payment before deductible. If you see a specialist, you have that $45 co-payment. As still you mentioned, the Connect Care is now at a zero co-payment. And then your urgent care, you also have prior to deductible. However, if you do go to the emergency room, that will be after deductible.
Hey, Jenny, I think your slideshow will work, by the way, if you just click up, not where it says from beginning, if at the very top, but not, just go up further at the top menu. Keep going up, over one. See that icon with the screen in it? It will work now, because I can see that it's now in bold if you want to. Just move over a little bit. Keep going. Oh, say from current slide. Just go down on the next menu, sorry, and then go to from current slide if you want to do that. Go to the left, up there from current slide.
Oh.
Nope, go up.
Oh,
there you go. Yeah, click that.
When I click it, it's not doing anything.
Okay, it looked like it was going to work.
Yeah.
Okay, never mind. I'll be quiet then.
No, you're good. Okay, so we're on to the HSA plan, which is your high deductible health plan offer. This is the one that you would use and pair with your HSA account. So this one has a little bit of higher deductible. You have the $4,000 individual deductible, the $8,000 for the family. On this plan, you have co-payments, but those only apply after deductible. So if you meet your deductible, then you have a co-payment for your primary care doctor. Otherwise, you would pay the allowed amount on that claim, and it would go towards your deductible. But the good news for 2021 is that you do have a zero co-payment for any of the Connect Care, even on the high deductible health plan. Again, your urgent care and emergency come after your deductible. So during the pandemic, it really made all of us kind of be creative, and even in the healthcare industry. So there were many providers who they had to find other ways to connect to their patients. So we've expanded a lot of our cares through our Connect Care platform. So our Connect Care platform doesn't only apply to urgent care. You can have virtual office visits with your providers now. Not all providers offer that, but there is that ability for some providers. And so you can still have that Connect Care or telehealth type service without it being an urgent care visit. This again is talking about Connect Care. This is a big one. I know Celia is big on this. It's such a good benefit. And if you haven't taken advantage of it, you really should. It's that zero copayment for any urgent care, even on your high deductible health plans. One thing that's new this year is we actually are offering mental health services as well through the Connect Care. So that's a big change. You would just go on to the Connect Care site. We do have a single sign-on now, which means your password and login that you use for your Select Health account would be the same password you would use for the Connect Care. So you don't have to remember different passwords all along the way. Another free service is our Health Answers. The Health Answers it's kind of like an Ask a Nurse. It's a 24/7 nurse line that's staffed by Intermountain nurses. You can call them 24/7. Another good benefit to this is there is a separate mental health helpline as well. So you can call the nurse line or you can call the mental health line 24/7 and get the help that you need. We do want to make sure that everyone's taking advantage of their preventive care offerings that are on the plan. Your preventive care is going to be covered 100%. For example, you have your mammograms, your colonoscopies, things like that are all covered 100%. In addition to our COVID testing and treatment is all covered at 100% this year. So the most important number for you to remember through this is our customer service line. So the 800-538-5038. If you have that number, you're going to be able to get the answers to any of the questions that you have, whether they can answer it or they need to warm transfer you to another department. They will get you to the person that needs to answer your question. So again, member services is going to talk to you about any of your claims questions. If you have a service that you're wondering if it's covered, you can call member services and they can help you at that 800-538-5038. They're available from 7 a.m. to 8 p.m. and then they're also available on Saturday from 9 to 2. Another service that we have is our member advocates. So member advocates can help you find any of your providers that you need to see. They're really helpful. There can be times where you're calling around trying to get into a doctor's office and there's no availability for you. If you call member advocates, they sometimes can help you get in sooner than you can when you're calling on your own. And this number, you can call them directly, but remember, you can always call our customer service lines and they can directly connect you to member advocates. One more access point for you to reach Select Health is our online customer service. So with our online customer service, you can do a live chat with us. You can also request a call back. So if if you're going to take lunch at 12:30 and you don't want to forget, you can schedule that time and our customer service reps will actually call you at that specific time. One of our most popular tools is our cost estimator tool. This tool, you can go in on either the web or on your application on your phone, and you can put in the services that you're going to be having, and it will take into account your specific deductible and out-of-pocket that you've met and give you a cost estimate for the procedure that you're going to be having. So it's super helpful. It kind of gives you the ability to shop around for your medical services and make sure you're getting the best care and cost. Your pharmacy is also a big one, and we try to have several different ways that you can fill your pharmacy needs. So you can do your retail 90, so any of your maintenance medications, you can get in a 90-day fill. You can also have it home delivered through Intermountain Home Delivery, or you can still go into your local pharmacy to pick up those prescriptions. And the one last thing I want to talk about is our Select Health discounts. So these are discounts that are offered to our Select Health members just for being a member. You're offered these discounts. So typically things that aren't going to be covered by your health insurance plan, but we offer discounts. For example, LASIK. It's not something that's covered on the medical plan, but we do have providers that offer discounts to Select Health members. So you go to selecthealth.org and you can look at our discounts. And this has been updated a year or so ago, and it has a lot more discounts than it did prior. So when you have a chance, just get out there and take a look and see if there's anything that works for you. So with that, real quick run through, are there any questions that anyone has?
I had a couple that came to me, and then I will unmute everyone and see if there were any others. On the Connect Care, that's at no cost all the way through 2021. That's correct.
Right.
And then, so it requires you to go or have some kind of device where you have video with it, right?
Yes. So you're going to want to, you can use a tablet, a laptop, a phone, any of those devices, but it is a face-to-face virtual type visit. So it's not just on the phone. You actually are seeing a doctor face-to-face and they're doing diagnostics that way.
Okay. And then the other question was where you talk about the COVID treatment and testing is at zero cost. Is that also through 2021 or just through 2020?
So as of now, we don't have an end date on that. And so I anticipate as long as there's a need for this to be covered 100%, it will be.
Okay. All right. I am going to try and see. Well, I don't know if I know the technology to unmute you guys. So if anybody wants to unmute themselves and ask a question, now is your chance to ask a question on health insurance.
So is there coverage for compound pharmacies or discounts for compound pharmacies?
So there is coverage for compound pharmacies, but you want to make sure that you're using a contracted compound pharmacy. Offhand, I don't know the list, but you can call into our customer service talk to our pharmacy team, and they'll be able to tell you what pharmacies would be covered.
Okay, and Jenny, that did remind me of another question that came into me. Where can people access a current list of providers?
So if you go to selecthealth.org, along the top, it's going to have find a provider. You can either select for a specific provider in a specific location, or you can also choose to download the most recent provider directory.
Okay. Any other questions on medical insurance, vision insurance, dental insurance, or life insurance? If you think of some, please feel free to send them to me in the chat, and Celia and Jenny will still be available later on in our meeting. So perfect timing. We are now going to move on to Greg Sanders. He is going to talk to us. He is from National Benefit Services, and they administer our 401k plan. So if you ever need a withdrawal, a hardship withdrawal, or there's a question about something you want to change with your 401k as far as maybe beneficiaries or any of that kind of thing, Greg can help us with that. So Greg, are you still on with us?
I am.
Okay, great.
Okay, I'm going to share my screen here. My face might look a little funny. I'm using a virtual background because I'm currently, like most office personnel, working from home, and I'm in an unfinished basement. So I'd rather you see a virtual background than my unfinished basement. But I'm going to share my.
You could have chosen a beach in Hawaii or something.
I know, I was trying to be creative, but it didn't happen. You should be seeing my screen now.
Yes, we have it.
Perfect. Okay, so again, my name is Greg Sanders, and my role with regards to RMD management and the 401k plan is really helping you as a participant and RMD management as a sponsor stay in compliance with the different laws and regulations that the government has in place for 401k plans. And so, as Sarah mentioned, one of my main roles that you as a plan participant would interact with me or my team on would be whether or not you can do some sort of transaction, whatever it is, on a case-by-case basis. If there's questions in regards to can I take a distribution? Can I put this money type into the plan? Can I take a hardship request? If I retire, how is that going to affect my employer money that's currently in the plan? Just different things of that nature. And so my screen here, what you'll see is we will cover the general provisions of the plan. And then Art Arzola, who will present after me, will really go over kind of the market side of things. So as an employee, after 3 months of service and you've attained age 18, you can participate by putting your own dollars into the retirement plan from your paycheck. And that is a generous provision that a lot of plan sponsors nowadays, you see a longer wait period. Maybe they might make you wait 12 months instead of 3. So RMD is really giving you the ability to put your own dollars into the retirement plan and save for your future. Get that nest egg started now. RMD management does provide an employer match after you have worked for 12 months and met a 1,000-hour requirement. If you contribute to the plan, RMD management will make a match contribution equal to 30% of every dollar up to 10% of your pay. And so if you're putting in 10% of your own dollars, RMD will match 3% of that total. The plan is governed again by the IRS, and so you have the ability to put in a set limit, up to a set limit each year. For the 2020 plan year, it was 19.5. with an additional contribution if you're over the age of 50 for a total of $26,000. That will continue into 2021. There is a vesting schedule that is applicable to the employer contribution that goes into the plan. The longer you work there, the more of that belongs to you. Essentially, if you work for 1 year and quit, that 20% of what RMD management puts into the plan belongs to you as an employee if you were to leave. The remaining 80% would go back to the plan to be used at a later date. So the schedule you'll see there in the vesting schedule section continues to go up 20 to 40 to 60 to 80 to 100. So after your 5th year of employment, 100% of that money that they give to you in the form of a retirement contribution is yours, and you can do with anything that you choose at that point in time when you separate employment. Hardship withdrawals are they do give you the ability as a participant in the plan. The IRS does a very limited ability to take a distribution. The idea is that the money that you put into the retirement account is designed to be a nest egg for your future at time of retirement. And if there is money to be distributed from the plan prior to normal retirement age, there's very limited reasons. And again, the reason for that is to encourage you to save. You'll see the 6 allowable reasons for hardship distribution in the plan. The first is a down payment or purchase of a primary residence. The second is to prevent eviction or foreclosure on your primary residence. The third is to pay college tuition, room and board, fees for the next 12 months for you, your spouse, or your dependents. The fourth is to pay non-reimbursed tax deductible medical expenses. So this would be things that maybe are out-of-pocket expenses that are putting you in a taxable situation where you, I guess a hardship situation, not a taxable situation. You can use it to pay for catastrophic casualty or loss, as well as to pay for funeral expenses for your dependents, as well as any beneficiary. So spouse, children, if your parents were living with you or they were deemed your dependent, you could use that to cover a funeral expense if needed. In-service withdrawals, meaning if you're still employed with RMD management, you cannot take distribution outside of those 6 reasons just mentioned unless you're over the age of 59 and a half. If you separate service from RMD management, you do have the ability to take a distribution. That distribution does become taxable income to you in the year that you take that distribution. The federal withholding mandatory upfront is 20%, and you do have the option to have state taxes withheld. The enrollment process is pretty simple. If you're not enrolled, I would encourage you to get enrolled and begin contributing to the retirement plan. Help yourself save for the future. Take advantage of the market as it's been performing. And if there's questions, you can reach out to myself or to Sarah or to Art, who you will hear from next. I think that's all I have, unless there's specific questions.
I have not seen any questions come in on the 401k.
Okay.
I do know that earlier in the year, we had a question, someone had heard about a withdrawal because of COVID. I think I spoke with you about that, and our plan does not include that provision. Is that correct?
Correct. At the present time, it does not meet those provisions. However, if there is a unique situation, reach out to Sarah and to Robert, and we can have that discussion.
Okay, thanks, Greg.
Yeah.
Art. Oh, I see Art. Here you are. Art's coming clear from Texas, zooming right in.
You like my fake screen behind me? My looks kind of fancy, but it's pretty dark outside, so it looks nothing like that. Let me get my presentation uploaded real quick here, and get this moved here. And away we go. Okay, again, guys, my name's Art Arzola. I work with Enterprise Retirement Solutions. We're a group within Zions Bancorp. And our role is to assist you all with the investment options, talk a little bit about how your 401k's been performing. So if you were to call, let's say, John Hancock, who's the record keeper of your plan, and you had individual questions, they can't help you with the investment part of it. They're going to refer you back to us. I have access to look at their accounts. They give me the rights to do that. So if you guys have any questions on that sheet that Greg was showing you guys just a minute ago, on the bottom right corner, our information, and I'll pop it up at the screen at the end of the presentation here. That's how you reach out to myself. You see my email address is listed on the screen. During this time of COVID, I've been doing most of my meetings virtually, and that means one-on-ones as well. So if you guys have individual questions, you want to set up a time to meet with me over 30, 40 minutes or whatever, just either call me, send me an email, and we'll set aside some time, and I'll send you a Teams invite, and we can meet that way. And that's probably the easiest way to go about it. I think they've gone really, really well. So let's kind of, again, as I mentioned, there's a summary of plan features, and on the bottom, if you have that sheet that Sarah had sent out, under miscellaneous, you'll see the website for John Hancock. If you haven't gone onto the site and logged into your account, you'll notice there's a contract number listed there. It's 15961. So they may ask for that information from you when you log in. But I will say this, that the John Hancock has kind of revamped their website recently. So before it used to be JH Pensions. So if you went to jhpensions.com, it's going to click you over to myplan.johnhancock.com. So that it's the same site, but it'll kick you on over there if you haven't logged in before. My number's on the bottom right corner there, the 800-324-6705. And then if you need to call John Hancock, maybe reset your password and so forth, you see their number listed there as well, 1-800-395-1113. I do want to talk about the investment options and about performance. Just as a reminder, wherever you invest your money, if it's, especially when you're talking about 401ks or IRAs, there's only 3 places you can put your money. You can put your money in cash instruments, which are nothing more than short-term loans. When we talk about cash, we're generally referring to things like money market accounts, savings type vehicles, low risk, low return type investments. So you guys have a couple of cash options inside your 401k. Then if you look at those accounts, especially over the last 10 years, and you see what they yield you, 1-2%, you might sit there and say, well, that's just not enough. I need to make more on my money. So the next step up the ladder is going into the bond market. And bonds work the same way. You lend money to governments or corporations and they pay you back principal and interest. The question is, who do you lend your money to? If you lend it to the government, the yield is going to be a little bit less. If you lend it out to corporations, it might be a little bit higher, but the risk is higher because you don't know if these companies can repay you that debt. So you kind of have to study the bonds that you're lending your money to, or who's going to pay you that principal and interest back. Now, everything that I've talked about so far, whether it's cash or bonds or stocks, and I'm going to talk about just a bit, all your options that you have in your 401k are mutual funds. So they're baskets of cash instruments, they're baskets of bond instruments. And then finally, you're going to have a bunch of stock funds in there. And again, when you look at a fund, it's a basket of typically a couple of hundred stocks or a couple of hundred bonds, where either a manager or a team's buying it. Now, if you go into the stock realm of things, the reason you're going into stocks is for growth. You're trying to make money over a longer period of time, but you understand there's going to be fluctuations. There's no guarantees. You buy a stock today or stocks today, they could go up in value, they could go down in value. So we can't make you guarantees. What I can do is tell you that over time, the performance on stocks, and when I use a marker for performance, I always talk about the S&P 500, which is the basket of your 500 largest stocks on the exchange. And when I look at that performance, it has averaged a little over 10% a year. If you go back to the mid 1920s, I can tell you that stocks average a little over 10. Now, those are your Fortune 500 type companies, your biggest, strongest companies out there. Smaller stocks, mid-sized companies, international stocks perform differently. They're more aggressive. Sometimes they do better, sometimes they do worse. But when people generally refer to stocks, they're usually talking about your Amazons, your Apples, your Googles of the world. Now, when you build a portfolio, if you're sitting here and you're saying, well, I've got to make decisions now, there's different ways we can do this in a 401k. My job is really to assist you if you want to build it yourself. And I'm here to make sure that you're not making mistakes. My role, the role I'm in, even though I'm a financial advisor, is not supposed to tell you exactly where to put your money, but I'm going to kick you in the right direction. And that's my role, is to make sure that if I see something odd or see something strange, I'm going to bring it up to you and say, I might want to rethink what you're doing there. But again, for a lot of folks, they just don't want to get bogged down with those decisions. They know they need to save for retirement, and Social Security is probably not going to be enough. So I need to set some money aside on top of that. For most folks, especially in 401ks, you have what's known as target date funds. Now, in your plan, the target date funds that are used are from Vanguard. And Vanguard, the advantage of using Vanguard is they're very inexpensive from a participant standpoint. Vanguard uses averages. They use what we refer to as indexes, like the S&P 500 that I just referenced. But it's really simple. If you don't want to pick your funds, all you do is you look to the right where it says year of birth, and you say, hey, you know what? I was born between 1983 to 1987. And if that's the case, your fund is the 2050 fund. And you let Vanguard decide how much goes into stocks and how much goes into bonds. And then they're going to modify that portfolio the closer you get to that target. Now, if you notice on the right, it says default fund. If you ask for a packet and you say, hey, I want to get into this 401k at the start of the year, and you enroll, but you don't want to make an investment decision, or you forget to make an investment decision, they're going to default you into one of these target date funds based on your date of birth. That doesn't mean you're stuck in there. If you want to change it, all you have to do is log in and make those changes. So you have the flexibility of doing that, but it's done through John Hancock because they're the record keeper. When money comes out of your check to participate, they send it to John Hancock, and then you're in control. You decide how it gets invested. I personally think that these target date type funds are sufficient for most participants that don't want to sit there and kind of track everything. I know that, I'm going to show you some slides in a bit about historical performance after elections and that, just because it's timely, and I think it's something for you guys to see. But at the end of the day, when you put money into a 401k, you have to think long-term for most of us. If you're going to be working for another 10, 15, 20 years, that's a long time frame. And you can't get caught up in the day-to-day noise that's going on in the market, specifically over the last year. Because I'm going to show you some numbers right now for performance since I last spoke to you all. And you're going to say, well, things aren't that bad. And it just depends on when you look at things. But I think a target date fund's just perfect for most folks. Let me show you how some of these work. If you're in their first one, which is called the income fund, that's geared for somebody that retired at least 7 years ago. And the primary objective of that fund is basically income. And what's income? Bonds. Bonds and money market or cash, because that's what they provide. The secondary and really secondary objective here is growth. And that's what the stock percentage is, only 30% in this portfolio. So it's low to moderate risk. But then again, if I'm talking to somebody who's 72, 73 years of age, they shouldn't have 80, 90% of their money in stocks. That shouldn't be their objective unless they're just naturally aggressive with their money. But most folks at that point in their life are very conservative with their money. So this would fit somebody like that. But again, this is if you're in a target date income fund 7 years past retirement. If I look at something like a 2020, somebody that's retiring this year, if you looked at that portfolio, Vanguard has about 50% of it put into stock funds and 50% into bonds and cash. So it's becoming more, it's already at the 50-50 point stocks to bonds, kind of a split objective, part income from bonds, part growth of capital, but it's never going to have more than 50% of the money in stocks at this point. Going forward, it'll always have less than 50% over the next 5-10 years. And within 7 years, so in 2027, this portfolio is going to have 70% bonds in cash and 30% stocks, and it's going to merge into that income fund. If I look a little further out, if I looked at the 2040, well, the 2040 is about 3/4 of the money in stocks, because again, this person has 20 years to go. So they're sitting there, Vanguard's managing the money saying, well, this guy's got this, this individual has 20 years. We're going to be more aggressive with them. because we can withstand the fluctuations of the market. So the objective here is more growth, higher levels of risk. And it's if you looked at a 2060 or 2065 fund, those things are 90% stocks because those people have to work 40 years. So that the whole thought process is, if you have a long time frame, accumulate stocks. But as you close in on retirement, you start playing defense. You start get into that preservation mode. And if you're in a target date fund, they're doing it for you. And for a lot of folks, if you look at here again, I'm going to pop up that sheet, and I think Sarah had sent these out to you guys. You see the target date funds at the very top, and I just want to point you to the year return, because this is since September of 30th of 2019 to 2020. And I want to look at, let's say, the 2065 fund toward the bottom of that first grouping, and you can see it averaged 10.11%, and that's kind of in line with what I talked about, how the S&P has done over the last 90 plus years at this point. So it's not perfect, but it kind of gives you an idea. So despite as crazy as it was in that second quarter of the year, the market actually has held up okay. But then below those target date funds at the very top, we have your individual selections. So you've got a short-term federal money market and a money market fund. So those are your cash instruments. In income, those are your 3 bond funds. You've got a Wells Fargo, a total bond market index, a PIMCO income fund. So you've got 3 different types of funds to pick from in the bond category. If somebody says, well, I want a little bit of both stocks and bonds, but I like a manager to kind of play both sides of the fence, we give you a balanced fund where that manager can have anywhere from 50 to 70% of the portfolio in stocks. And then that fund actually did pretty well over the 1 year, 9.4. And then right below that, in orange and red, those are your stock funds. And the further you go down, the more aggressive it's becoming. So down toward the bottom, when you get to the Euro Pacific Growth by American funds or the Columbia Overseas funds, those are your more aggressive ones. But you can see it when you look at those 1 year returns. I mean, the one that just sticks out of me when I looked at this sheet yesterday, you see that Wellington Mid-Cap Growth Fund, it was up 52%. That doesn't mean it's going to go up 52% again. It just says over this 12-month period, it skyrocketed. And anything with the word growth tied to it, and you see under Morningstar category, whether it's large growth like the Blue Chip Growth Fund, or the mid growth that I just talked about, or the small growth, the Vanguard Explorer, those funds have done really well. And the reason is tech stocks have done, and I'm going to show you some data in just a bit to back that up. So anything growth related, tech oriented, has just been on fire, even despite the pandemic where it had a dip, but it's done extremely well. Just again, as I mentioned, you have a couple in the cash category there. There's your 3 bond funds, there's your balanced. And then when we get over to stocks, you've got value on the left side, Vanguard, the T. Rowe Price, and the Vanguard Small Cap Value Fund. And when you see the word value, think about bank stocks, insurance companies, nothing flashy. If you see the word growth on the right side, those are going to be your tech stocks, your pharmaceutical companies. You're going to pay more for those stocks, but you want movement out of that. And a blend right down in the middle is a combination. And we have indexes in each one of those categories, whether it's the 500 index, which again, as I mentioned, the 500 largest companies, mid caps, which are smaller companies, $2 to $10 billion size companies, and then small cap from a TIAA CREF fund. It's small companies under 2 billion. One of the things to note, it won't pop up on it might pop up on my screen next, but small company stock funds have got hit a little harder because of the companies that were well capitalized have seemed to do really well. Smaller stocks who tend to borrow more money have been hurt a little bit more during this pandemic period of time. And then on the international side, you've got 4 selections there: a Columbia fund, one from Fidelity, American Funds Euro Pacific Growth Fund, and a John Hancock International Growth. One of the things in my role is, if you're building this yourself and we have this discussion and I pull you up and I see what you're in, if I see this international part, I like participants to be at around no more than 20% of their money on the international side. So I like to kind of dig into that, because sometimes I'll see people that really go overboard on that. And if you're not paying attention to this, you can get burned pretty easily, because these tend to be more aggressive type funds. So, you know, again, this is the role that I play for you guys, and you can access me at any point to have those discussions. I did want to show you these final screens here. I mentioned the 1-year performance, and cash is on the bottom left, that 3-month T-bill. And so that gives you an idea of what money market funds. Now, since this pandemic started, the Federal Reserve lowered rates tremendously. So this number is going to start coming down over the next quarters, but it was 1.14 over the 12-month period. A good indicator of bonds is the Barclays BarCap Index, and that's about a 7% yield. So that's what bonds kind of paid out, good quality bonds. The Dow is a marker of only 30 stocks. So rather than use a smaller gauge, we like to use the S&P 500, because you're more diverse. You got a better indicator of how the economy is doing. So as you can see, the S&P over that 1-year period did about 15%. Again, historically about 10 over the 1 year since September to September, 15. So that's a good return. However, small company stocks, which is the Russell 2000 small companies, only did 0.39. So the performance is vastly different from large Fortune 500s to really, really small companies. NASDAQ has a lot of tech in it, and you can see how tremendous it has performed over that 1 year. That explains, you know, that mid-cap fund that's up, you know, 52, because it has a lot of those tech-oriented options. EFA and the MSCI EFA are international stocks, only up about 0.5%. So it's treading water positive for that year period. And then you have commodities at the very end there. A lot of that's tied to oil and energy. It was down about 8% for that year. So that kind of gives you an idea, a gist of where the market's done. I will show you one other thing in you know, sector performance over that 1 year. Tech, as I mentioned, without a doubt, leading the market at 47%. Cyclical stocks, homes, car purchases up 36%, healthcare at 23%. And as I mentioned, energy at the very bottom, down 44%. So when you look at a fund and you see if it's heavily structured toward energy or maybe financial services, you kind of get a feeling those are value-oriented areas that they probably didn't do as well over that 12 months. If your fund had a lot of tech in it, it probably did really, really well. I did want to finish up on these last slides, because the election, you know, that was held yesterday. We're still kind of, things are in limbo, but I like to show this slide that came from one of our vendors, so that you guys can kind of get a gauge as to performance. And this is, as the orange bar charts are stocks, the yellow bar charts are bonds performance. And if a new president's elected, the performance in the subsequent year tends to favor stocks about 9% to 6.7 in terms of bonds. And all presidential years over times, from start to finish, from January to December, up about 11% for stocks, about 5.5% performance for bonds. And if the incumbent president tends to win, the performance has been a little bit more in favor of stocks at 13%. I think whenever you look at this information and you hear about stock performance, and I think we had it 4 years ago when the market dropped immediately and then bounced back quickly, it's adjustment of portfolio. These fund managers they like to see stability. I was on a call this morning, and they want certainty. They want to understand, you know, if there is a change in presidency, what are going to be the objectives? You know, when they hire a Treasury secretary, whoever they may hire, how's that going to kind of lead going forward? And then this is, I think, probably the best slide to finish up on here. Whether the same party's in charge, and since 26, that's happened 47 years of the time, and through 2019, divided government's 47. So it looks like we're going to have divided government again. It looks pretty secure on that. And if it's divided government, it's always been kind of even after 1 to 3 year cycle, 10.8, 10.9% overall return. If the same party tended to win. So if let's say the one party wins the House, the Senate, and President, the first year it tends to do pretty well at 13% plus, but after that it trails off and actually underperforms a little bit. So I think that gives you kind of an idea. I think people overthink it. As I mentioned, fund managers have a tendency to adjust their portfolios. As I mentioned, finishing up, if you need to reach out to John Hancock, their website now is still jhpensions.com, but I think if you update it to myplan.johnhancock.com, Their contract number, if they ask for it, is 15961 for your plan specific. And if you need to reach out to myself, I can be reached at the hotline there. Again, my name is Art, A-R-T. I answer any of the calls that come through. And if you want to set up a time, I'll be glad to do that with you guys. Sarah, do I have any questions that they kind of popped up during my presentation, or does anybody want to ask questions?
We had one question come up. I don't know if you want to take it, or Greg, if Greg's still on, about eligibility when a new employee is able to enroll in the plan.
Greg,
Yeah,
do you want to jump on that?
Yep. So as a new employee, once you have completed 3 months of service, meaning you've been employed for 3 months, and you have attained age 18, you can complete the enrollment paperwork or the enrollment process. The contributions or the withholdings from your paycheck won't start until the first of the next quarter. And so after you've met that 3-month requirement and you are age 18, go ahead and let Sarah know. She'll get you pointed in the right direction as far as enrollment goes. And then again, the first of the next quarter, you will see those withholdings from your paycheck.
And we actually have an auto enroll feature. So am I still on? Okay.
Yep.
I was running out of battery. We have an auto enroll feature. So if you don't do anything, you'll be automatically enrolled at 3%. But if you want to do something other than that, or invest in some other funds and talk to Art about options available to you, then definitely that's available to you.
I might add that if somebody's auto-enrolled, they're auto-enrolled on a pre-tax basis. The plan does allow for Roth contributions. So if somebody would rather do an after-tax contribution where their money grows tax-free, that is an option, but they'd have to actually physically go change that by notifying it on the enrollment by going to John Hancock and making that change.
Right. And informing us so that we take it out.
Correct.
So, okay.
Sarah, I just wanted to point out one other thing. I know Art, you had mentioned giving John Hancock a call if they have questions. You're welcome to use them as a resource. John Hancock has recently started doing some additional fraud protection measures on participant accounts. And so when you call in, if you choose to call into the John Hancock number, you will need the contract number that Art provided, 15961. But they will also ask you to verify your full name as it's spelled on the account, possibly your full social. And then also they've been using the mailing address that's on your account as well. If there's no mailing address tied to your account, then they won't allow you to speak with them. And so if there are concerns or questions, if you're concerned that maybe your address on file is not correct, get with Sarah or myself. We can get the John Hancock system updated so that you don't have issues when you call in.
Great. Thank you for giving us that information. And Art, thanks for that education. That's always good for us to be aware of what we're looking at and what we're looking for. All right, we're going to take, and if you have questions that come to you, Art and Greg will still be available in the next little while. We're going to turn some time over to Danielle Higley from Workers' Compensation Fund. They provide us with workers' comp benefits, and she's going to kind of let you know what kinds of things that they can do to help us.
All right. It looks like you guys are you seeing my notes view, or are you seing just the PowerPoint?
We're seeing your current slide and next slide. Okay.
Well, we will change that. Let's see. There we go. All right. So I think I'm the last one. So I know I'm between you and Freedom. So we'll try to make.
We've got to do the FSA and HSA.
Oh,
so
okay.
They're not quite to Freedom yet.
Okay. Well then, all right. You're stuck learning about workers' comp, whether you want to or not. So I am RMD's safety consultant. So some of you guys might have seen me out at your various locations and job sites, but my main job is to try to help you guys not have injuries while you're working. But wanted to just kind of give you a basic understanding of what is workers' comp. So it's a no-fault system. It's something that if you get hurt while you're at work. And this, the most important part is the quote at the bottom. So by an accident arising out of or in the course of employment. So you have to actually be working, and it has to be, you know, if you're driving around for RJ or Delta or whoever, that if you kind of take a big deviation away from that, you take a joyride, or you want to go see the fall colors while you're driving from one site to the next, we don't cover that. So you have to actually be in the process of work for us to cover that. Well, if you have an injury. So the main purpose of workers' comp, that's before they had it, it was kind of like if you got hurt or killed, you were on your own and you had to try to sue your employer, and that didn't go quite so well. So this came around to try to help reduce injuries in the workplace, reduce employer liability. So if things happen, it's just covered under workers' comp. You can't come back around and sue RJ for getting hurt. And we want to make sure that if you do get hurt, that you're going to get taken care of as far as your medical costs and any lost wages that you might have. And it also just helps reduce litigation for everyone, because we're not running around trying to sue everybody if we do get hurt. So that's kind of the purpose. WCF has been around since 1917. We started off as a state organization, and have in the 80s kind of broke away from that. And now we're a mutual insurance company, which means you guys own us. And so any extra money we have at the end of the year, we give back to you guys. And we also have branched out into other states. So we do provide coverage in other states. So if you cross state lines and you're still working for RMD in Utah, you'd be covered under the Utah policy. If you hire somebody in a different state, then you need to get a policy out in that state to be covered, but we can do that for you. So it is something where we do try to provide coverage for you guys while you're at work. And some people ask, well, what do we cover? So we have your medical bills is something that we always have to pay for. And if there's any other medications or things that you have there, we cover that as well. And then if you are not able to work, we pay 2/3 of your average weekly wage for the time that you're not able to work. It does take, in the state of Utah, it takes 3 days in order for that to kick in. So if you're off work for 2 days, then you're not going to get paid unless RMD decides to pay you for it. But otherwise, we would kick in and make up the difference of those wages for you. So we have that. Like I mentioned at the beginning, we do partner with you guys to try to help reduce your injuries overall. So you'll see, I'll go around to different job sites. We'll try to point out some hazards, some things that we feel like you guys could improve on to make sure that nobody gets hurt on the site. And then we've also done quite a bit of silica monitoring and also noise monitoring to see what your exposure levels are and see how we can reduce that exposure to you guys. So that is something we try to help you make sure that you're protected and make sure that you don't get injured, because the ultimate goal for me is to send all of you guys and everyone that works for you home at the end of the day in as good shape or better than how they came to work that day. So that's the ultimate goal. We do have, just kind of want to talk about just cost of insurance and how that kind of affects your bottom line. So we have direct costs when somebody gets injured, which is those medical bills, those wages. And then we have indirect costs. And so studies have been done that basically with those indirect costs, one accident can actually cost about 5 to 50 times the direct costs of an injury. So we kind of relate it to an iceberg. So we say, all right, those direct costs are what we see on the surface. That's your wages and your medical bills. And then we have all those things that kind of come into play when someone gets hurt. So we have, other people that kind of get freaked out if they see something happening, if they think that they're going to breathe something in and die, other things that they have. You have all the time that it takes for it. So that's also why it's important to us to keep you guys working and keep you safe, is because we want to make sure that you are in a situation where you can stay productive. When someone gets injured and you kind of lose your lead person in a specific task, then it's hard to replace what that person knows. And then other people are trying to make up for it and then they get stressed out. So we just want to make sure that we kind of help you guys control your overall costs on that one. But if you do get hurt, we want to make sure that you report that injury immediately to your foreman. Maybe some for this group, that's probably some of you guys. We want to make sure that you report that to Cody. And a lot of times he goes to the doctor's visits with your injured employee. And we want to make sure that you go to a designated facility. So you guys have designated where you would like people to go when they're injured. Most of the time that's either work med or work care. And those are better than like your Instacares, because Instacare is not really set up to get you guys back to work. So if someone hurts their back or they fall off the scaffold, they're going to say, oh, you have to take all this time off of work, when work med or work care is much better at figuring out what you guys can do and getting people back to work sooner, which is much better for the mental health of anyone who's injured. And it's also better for the bottom line of every company too. We want to make sure that you follow doctor's orders. We have had incidents in the past where someone has not followed what the doctor said and they actually made their injury worse and had to get second surgeries and additional medical treatment. So we want to make sure that whatever the doctor says that you should or should not be doing, that you are following those doctor's orders. And then we want to get you back to work as soon as possible. You know, like I mentioned, it's a lot better for you guys and your groups to come back and make sure that you're healthy and productive. A lot of times if you're sitting at home wondering if you've got a job, then it's not really good for the mental health of the person who gets hurt. We do want to make sure that whenever you do get hurt, you're going to have a claims adjuster call you up, and they are there to help you. So you can ask a lot of questions. If you don't understand what the doctor wants from you, you can ask questions of that. But they are also going to ask you for information. So you want to make sure that you give them information about yourself. We get wage information from you guys as well, so we know what to pay you if you've lost some time off of work. So we just want to make sure we're working with our adjusters. And then really the benefit of coming back to work after you're injured is making sure that number one, it helps people just mentally. Number two, it does help manage your medical costs. So if we have people come back to work soon after an injury, it actually helps the bottom line. It helps the EMOD for your company stay low so that you can bid for jobs and maintain those jobs. And so it just kind of helps when everyone's working together to bring people back to work and come back to work as soon as you can. There will be some injury situations where that's not going to be possible, but we want to make sure that we try as much as we can to get people back doing what they do well. We also want to make sure that we stay in good communication with someone when they're injured. We have had people who kind of tend to disappear when they get injured because they figure they're fired. And so we want to make sure that they do understand, no, this is a benefit. It's something that RMD is required by law to provide. And so it is something that you guys, if you are injured at work, can utilize on that one. Also, if we have people coming back to work, that does decrease fraud. Believe it or not, I've been doing this for 25 years now. And when I first started, we had people who would commit a lot more fraud than they do now. And that would be that they try to fake an injury. We have doctors who would try to bring you back for extra visits. And so if we bring people back to work after they're injured, if they're just trying to get a weekend off or other things, it decreases that greatly by making sure that you have a program where you can bring people back to work. And that is something that you guys do well. You've accommodated most everyone that you could accommodate to bring them back to work. So I just want to make sure we keep on doing that. So that's kind of your basics of workers' comp. We could talk a lot more about safety if you wanted to. But do you guys have any questions, concerns, anything that's been weighing on your mind about workers' comp?
I didn't see any questions come in our chat. Does
All right.
anybody have something they want to unmute and ask?
All right.
I don't think so, but we do appreciate that you help us keep safety as a priority. As always, it is a priority for us.
Yeah, you do very well. You have a great safety program. So we just want to make sure that we can keep you guys with all your fingers, toes, and eyeballs and all that good stuff. Want to
Okay.
keep you in good shape.
Well, thank you. We
Thank you.
appreciate workers' comp. They're a great member of our benefits team, and Danielle especially, we appreciate her. She comes to our job sites once a month and really keeps us in touch that way. We are going to spend the last 15 minutes of our meeting going over FSA and HSA, and I understand our FSA provider lost their internet connection, and so Celia is going to take that presentation, right, Celia? There you are.
Yeah, yep. I'm gonna, if you know, I can have Scott go first since he's been patiently waiting, and then I just can go at the very end. Scott, are you there?
Yep, I'm here, Celia. I can take it.
Okay. All right. Thanks.
Cool. Let me bring up my screen here for everyone. All right. Thank you, everybody, for taking just a few minutes to talk about HSAs. Still very an exciting thing. As you well know, during open enrollment is the only time that you can switch plans from the traditional plan to the HSA qualified plan. So if you're thinking that it was a mistake that you didn't jump into it last year, now is your opportunity. Remember, a health savings account does go along with that specific health save plan that's offered, the higher deductible plan. And so once you are enrolled in that, you're eligible to open up a health savings account. Remember, an HSA is a tax advantaged account that you own as an employee of RMD. The money that's put in there, both the money that's put in by RMD and any money you put in through payroll, is yours to keep for the rest of your life. So HSAs allow you to be able to build health savings in a type of plan or account. With a traditional plan, if you open up, if you get the traditional plan and open up an FSA, that's a great way to use tax-free money, but it doesn't allow you to save up year over year for future expenses. With an HSA, you're able to put away the same tax-free money because you're not paying Utah state income tax or federal income taxes on the dollars you put in your HSA. And then at the end of the year, if it was a healthy year and you didn't have to access any of those funds, or you only accessed part of those funds, whatever balance is in there rolls to the next year and continues to roll over year until you need to access those dollars. So you even have access to your HSA when you retire. So if you think you may have some medical expenses in future years or when you retire, an HSA is a great way to put dollars away to plan for those expenses. Most all of us will have some medical expenses in our life. If we happen to be lucky enough that throughout our working career we're fairly healthy and we don't go to the doctor very much, we don't take very many medications, then by having an HSA, we can put those monies away. And then when we retire, towards the end of our life, we may have some medical expenses at that point, and we can use tax-free money to spend on that. If I didn't have an HSA in retirement, then I'd have to pull money out of my 401k or IRA and pay tax on those dollars, because any income that I pull out of those accounts, I'm going to have to pay income tax on, and then I'm going to use that for my medical expenses. So again, an HSA is a great way to save for your retirement. If you end up being healthy all the way through retirement and you have money, extra money in your HSA, you can pull it out after the age of 65 and use it for regular income. You would not have a penalty anymore on it for using it for something other than medical, but there is income tax that would be applied at that point. So let's say I did really well, I was pretty healthy, and I had $150,000 saved up in my HSA. I retired, and 10 years into my retirement, I'm still really healthy. I've got lots of money. I don't want to just have it, go to some of my family members when I die, and so I want to pull some of it out and buy a car or put some money down on a condo or buy some property somewhere or whatever it may be. I can pull those dollars out, and I'm just going to apply it to my income at that point in my life, whatever tax bracket I'm in retirement. I'm going to pay the income taxes on that. If I continue to use it for medical expenses, so when I go to the doctor, when I go to the hospital, when I pick up medications and cover those expenses, I never pay any tax on it or any penalties. So again, the money that goes in right now while you're working is there for you to use this year or next year or in future years. So very much a great opportunity. And now is the time that you could choose to switch over to that plan if you did not choose to switch it last year. Also, if for those of you who maybe jumped into the high deductible plan with an HSA last year and decided that wasn't for you, during open enrollment is the time you can switch back to a traditional plan as well. Any monies that you put in your HSA are still yours to keep and use. You'd never lose those dollars. You get to keep them in your account and use them for those qualified medical expenses. If you want to contribute to your HSA, you can also choose how much you want to put in, and you actually can change that dollar amount anytime you need to throughout the year. So if I might move to the next slide here, I'm going to tell you what you can see that slide now. So the new HSA limit for next year has increased a little bit. It's $3,600 if you're covered by single coverage, $7,200 if you have anyone else in the plan. So that would include single parent, couple coverage, or a family of 10. So the IRS max for that is $7,200, and then both this year and next year, and if you've reached 55 during the tax year or are past 55, you can contribute an additional $1,000 to either of those numbers. And that catch-up contribution is based on the account holder. So if you're 54 and your spouse is 55 and the HSA is in your name, you still have to wait another year before you can put that catch-up contribution in. But again, these dollars are going in pre-tax, and whatever funds you put in, also keep in mind the money that RMD is giving you, because that does also go towards this total amount. So if you can contribute this money and don't spend any of it, all of it rolls over to the next year. And if you continue to do that year over year, you're going to be able to build up that health savings account pretty quickly. If you have to access some of those dollars, then that's what it's there for. You can use it for those medical expenses. And if you have to access all of it, then that's why it's there to help you meet your deductible and meet those out-of-pocket expenses you have for your insurance. Again, an HSA is a great thing for you to have. For those of you who have one now, it's an opportunity for you to continue to save and think about investing it. For those of you who don't have one yet, it's an opportunity for you to think about, would this year be the year for me to jump into the high deductible plan and look at that HSA and start funding that and getting the money that RMD also contributes to it? Like I said, now is the time to make that decision. And if you want to put money in, you can start off with whatever amount you think would work. And if you need to update that throughout the year, you can just go over to your benefits team, to HR, and make that change at that point. So that's all I wanted to cover today. Are there any questions before we turn the time over to Celia for the FSA portion?
I did not have any questions that came in the chat. I did want to thank you for helping us understand the value of having an HSA account as part of our future financial planning, as well as using it now. In our discussions with Team Nash and surrounding insurance, we feel like probably the high deductible plans will continue to make healthcare coverage affordable in the future, and having an HSA account to cover that higher deductible and that higher out-of-pocket maximum is crucial to making those plans beneficial. And so that's kind of what we've done with our match this year, is made it to encourage people to take advantage of the match that RMD has given, but also to put some of their money in so that they can build that HSA up and have that nest egg kind of to cover the out-of-pocket and the deductibles and the out-of-pocket maximums that are associated with the HSA accounts or with the high deductible accounts. So thank you very much.
Perfect. Thank you, Sarah.
Yeah, did anyone else have a question on HSAs? All right, well, you can put it in the chat if you want, and Celia, we'll let you finish this up with the FSA.
Okay, so I was just given these slides on the FSA, and I'm not going to go through all of them because there were quite a few of them. I'll skip through some of them, and if there are specific questions, then let me know. But I know a lot of people are really familiar with the FSA. There were some good points that she said about the FSA. One is that, for dependent care, keep in mind on the dependent care, the things to keep in mind is that it's only for children under the age of 13. The dependent must live with you. And if you're married, your spouse must be work or be a full-time student. So there is criteria for the dependent care. Under the FSA, the limits remain the same as last year. That has not changed, as well as the dependent care. So you'll see that when you go through open enrollment that you have the option to continue again in FSA and dependent care. And I mentioned this before, is that by compliance, you can't, like RMD cannot assume what you want to elect going forward. They have to get your election. So if you do want to contribute to an FSA, make sure you go into Employee Navigator, make that election. I was able to confirm that the hearing aids are not covered under a limited benefit or hearing services. The only thing that's covered under a limited benefit FSA is your dental or vision expenses. iSolved, which used to be Infinisource, they're probably one of the top companies for administration for FSA. They just have some really neat tools. So keep in mind, getting reimbursed off the expense happens. You don't have to prove that you actually paid anything. They just need to have the receipt. You can submit it online. You can submit it through a mobile app, and then you can receive a check in the mail or direct deposit with just, within days. So I would encourage people to set up that direct deposit if they have, if they're comfortable with it, because the money is automatically deposited into their paycheck. And then for the reimbursement on the FSA, the easiest thing to do is for any kind of thing that's medical, is submit a copy of the explanation of benefits. If not, like you're going to get, let's just say you do decide you need to get some dental services, then you do need to submit the reimbursement form. If this is assuming that you have not submitted using your debit card, because of course you can just use your debit card to pay for the service. But they will eventually ask for, under the FSA, they do ask for proof. And so keep those receipts, and then they're going to want to see those receipts just to make sure that they're all in compliance. Under the HSA, they don't ask for the proof. They just recommend you keep the receipts, but they'll never come back and say, hey, prove that this was really a qualified medical expense. There are some yeah.
Can I say one thing about that also? On the FSA, if you use your debit card and you get a request to provide that documentation, please submit it, because otherwise we have to put that as income to you. You'll be taxed on it on your W-2 form. So
good point.
I'm getting emails from Infinisource every month about some of our participants who still need to provide documentation for services that have been paid for, and that will become taxable to you if you can't provide the receipts. So I'm sure that you'll have the receipts, so get them sent in so you don't have to pay tax on that. Good point.
All right, so over-the-counter medications, I'll go back, they used to not be, what was covered, and then they changed some regulations so it's not covered, but they are covering some over-the-counter services. And so like bandages, splints, contact lens, if you submit those, they will cover those. But these kind of things that they'll only cover these certain conditions if you have a doctor's prescription. So instead of your doctor writing a prescription, say for, I'm just trying to think of something that there's several allergy medicine that's over the counter now. You can use your FSA for that, but you need the doctor write a prescription that says, I want you to take Claritin. Then it will be covered under the FSA. Dependent care, same thing. You're going to need the documentation on the dependent care. This is just, again, reminding you, save your itemized receipts. You can use your card at the time of service. However, if you don't have your debit card, don't worry, you can reimburse yourself. And it's an easy process to get that done. And anytime you guys have any, questions or concerns or help with trying to get reimbursed, please call our office. Myself, Akshay also is really good about helping people getting their claims reimbursed for the FSA. And let's see, we all know they will pay for the copays. It pays for things, what they say is qualified medical expenses. So it's pretty much most medical expenses. It doesn't cover for cosmetic things, but there's a lot of things that they do cover. And then they will let you know on here, these are just the receipts by letter. They'll ask you to send in the receipts 15 days. They're going to send a second letter 30 days. They'll send another letter. And then if you don't respond, they will deactivate your card because they really need to get the receipts. That's part of the requirement of administering of FSAs. They need the receipts. So this is just talking about the debit card, the advantage of it. Keep in mind you have the use it or lose it. So you do have a $500 rollover. And what that means is if you haven't used, $500 or less of your FSA election for the year, that will be rolled over to the next year. So you will not lose that. So if anybody has any amount over 500, I'd recommend them go out and make sure you get that spent. If you have to do some over the counter and get a doctor's prescription for that, just so you can at least get it down below that 500 and then you're safe. It does the rollover. As Sarah mentioned, on an FSA, you cannot change, or maybe it was Scott, that you cannot change your FSA election in the year unless you have a life event and like marriage, birth, adoption, divorce, but it has to be made within 30 days. So let's just say you get a divorce, you drop a dependent off your insurance, you want to change your FSA election, you can do that. So that is a quick rundown of the FSA because I know this is a long meeting and I wanted to get it done in time, 7 o'clock. So we did it.